Good morning, everyone, and welcome to our weekly media call. I'm Chris Trumbauer with the County Exec's office. We're going to get started in a sec. I do want to announce that we're going to try and end by 11:30 today. So with that, I will turn it over. We're going to do the County Executive first, followed by Health Officer Nilesh, and then Kathy Koch from Community Development has an announcement, and then we'll turn it over for questions. So with that, we'll turn over to County Executive Stuart Pittman.
All right, well, thanks, Chris, and thank you everyone for joining us. We finally made it to March, and the sense of anticipation and hope seems to be growing all across the county. I'm pretty ready for some green grass and some flowers, and we're all ready for the end of this pandemic. Nothing great comes easy, though, and after 6 straight weeks of declining case rates, our numbers have leveled off. And even ticked up to a case rate of pretty close to 15. Last week we got down to 13.5. So we've aligned our restrictions with the state, and we hope to continue that way. But we heard yesterday from the CDC that an estimated 10% of new cases are variants that may be more contagious. So they've asked states and local jurisdictions to pause any further reopening until we're able to push the numbers down further. I trust that the governor is listening to that as well. So we have to hang tight and do what we can to push these numbers down. I want to thank our health department and liquor board for continuing to monitor bars and restaurants, reminding them that their clientele, that masks must be worn at all times unless seated at tables of 6 or fewer that are separated by at least 6 feet. That means drinking maskless by the bar is unsafe and a violation that puts the establishment at risk. So please, everyone, cooperate. I also want to thank the owners of Cancun Cantina for their cooperation with our inspectors at Saturday night's inspection. The best news of the week is that our health department will receive 900 doses of Johnson & Johnson vaccine this week, plus an additional 400 doses of Moderna on top of the 3,400 doses already scheduled to arrive. Johnson & Johnson is a huge breakthrough, and I don't want anybody to assume that the lower effectiveness number coming out of their trials makes it a second choice. It's the first vaccine to get unanimous approval, and anyone who's eligible and offered an appointment should take it, including me. I'm in the 1B continuity of government category and have not been vaccinated. I plan to get in line for Johnson & Johnson vaccination and will be happy to report back on how that went. Vaccine surfing is a flawed public health strategy for that vaccine distribution. I think we've all come to that conclusion. People with free time and computer skills get to the front of the line. That's why our health department's equitable selection process for appointments, its telephone assistance in setting appointments, and its new community vaccination clinics are so important. And Dr. Caliana Robin is going to be speaking further about the newly released principles for equitable vaccination that they've put out just today. But I want to thank both the Health Department's Office of Health Equity and Racial Justice and the COVID Equity Committee for their hard work on this. By addressing access, communication, and engagement, I think they will be able to right the wrongs of our past and get our most vulnerable residents in this county vaccinated. Last night's virtual town hall in honor of Robert Eads was a great kickoff to this effort. Yesterday was the first day of hybrid education for many of our students, and I want to thank all school staff for making it happen. In particular, I want to encourage everyone to thank the teachers who are figuring out how to connect with what one of my son's teachers called yesterday both roomies and zoomies at the same time. I also want to thank Superintendent Arlotto and his staff. The challenges that they have faced this year would be crippling to many, and they just keep figuring out how to get things done. But at the end of the day, everyone involved is doing it for the wonderful children who will inherit what we create. So thank you to all of you. The $900 billion relief package that Congress passed in December includes eviction prevention funds for every county. including 17 million for Anne Arundel. And once again, our team at Arundel Community Development Services is the first in the state to open a portal to get the money where it needs to be. So Kathy Cope will give you some details after this, but I just want to say how important this will be and what amazing work they do at ACDS to counsel and protect families who face the terrifying prospect of eviction. I've been accused of providing too much news in these, but I have a few quick announcements of upcoming stories so that you who are reporters can plan your week. Women's History Month is here, and the county executive staff, which happens to be 66% women, have put together local stories that you can follow on our social media platforms. On March 30th, we will honor 10 current history makers in a joint event with the Caucus of African American Leaders. Last night, I broke tradition and addressed the County Council directly at the first public hearing on the most important document I will ever present to them, Plan 2040. We also released a short video on the plan today, encouraging residents to read it and comment. And tonight at 6 o'clock, I'll be joined by Senator Elfreth and Delegate Bartlett, as well as my legislative staff, for a town hall to discuss the bills that matter most to our residents in the General Assembly. And you can participate on our cable channel or Facebook Live. And at 12:30 today, I'll be at the Brooklyn Park Library for a special announcement concerning all county libraries. My only teaser is think more access and fewer fines. And finally, I want to celebrate the completion of a very large task. Our small team of 2 at Arundel Stat has added the last 3 of 30 departments to our portal, Open Arundel. So you can go there to see performance metrics for every county department. The 3 new additions are Board of Elections, Partnership for Children, Youth, and Families, and Arundel Community Development Services. So thank you for bearing with me, and I'll turn it over next to our ever-present and ever-working Dr. Kalyana Raman.
Thank you, County Executive. I'll start with, I'll start with data that we talk about each week. So we're seeing that our case rate had plateaued last week for I think about 6 weeks straight. We've been talking about decreasing cases. Reached a low of 13.5 or so, and up to 14.9 now. That case rate is obviously better than what we saw in the winter surge. But it's important to remember that it is actually the case rate that caused us great concern great concern in late October, early November, as we were looking at what would happen as that case rate grew. So it represents continued community spread, and I'm going to talk more about that in a minute. We're seeing that our percentage positivity finally is below 5%. It was 4.9 last week, the week before, 4.6 this week. That's good, but we have seen decreased testing overall, still in the high it was 2.5% the week prior, 2.7% last week. And so we are just a little bit concerned that we are missing cases that are contributing to spread. While those cases may not be severe in and of themselves, they can be passed on to others who may not be able to weather it. Our hospitals are in slightly better shape. Decrease in the census of the hospitals down to the 50s. That's good, but they're still kind of on that nice edge. They're just beginning to, in the past few weeks, resume their full slate of outpatient and elective surgeries, and we want them to be able to continue to do that. In terms of deaths, we did see an increase last week. It's a little hard to interpret if that's a trend or a blip, but it is a blip of 16 people who passed away. So it's not a trivial issue. It's something that is continuing to happen. We're still seeing people pass away from this virus. I think that sets the stage for where we are. We're seeing a slight uptick in cases. We're really not at a case rate that suggests that we've suppressed spread in the community. The good side, we have vaccines going out. Over 20% of people have at least 1 dose. But the big concern is the variants, as the county executive mentioned. CDC announced that approximately 10% of cases nationwide are due to variants. Only a few weeks ago, it was about 1 to 4%. We've seen in other countries is that the variants can spread quickly. So we've got this issue where we've got two forces that are a good one and a bad one. We're getting more vaccines in, but we also have a set of viral variants which are spreading more rapidly. And the fact of the matter is that based on vaccine supply, we're not going to be able to get everybody vaccinated before that variant, as that variant continues to spread. So we continue to have to be really, really careful about how we're masking, about limiting our activities, about not loosening restrictions. We're not out of it. We can see the end of the tunnel, but that doesn't mean we have to stop moving. We've got to keep doing what we need to do to get to the end of the tunnel, get everybody vaccinated. Along those lines, we're seeing that like I mentioned, we have a little over 20.8% of folks in the county have received at least one vaccine, 13.7% have received one, 7.1% have received both doses. We are getting 3,400 doses of Moderna each week. This week, we're getting an additional 400 Moderna and 900 Johnson & Johnson. Our understanding is that those are one-time increases based on just getting supply out the door. So not sure that will continue next week, but that is okay. We will take what we get now and we'll get that into arms. The Johnson & Johnson data, I think it's really important to understand what efficacy means. When the studies talk about efficacy, they're talking about any symptoms that a person has or a diagnosis. So when you hear that Johnson & Johnson is 66% effective, that means it's anywhere from mild symptoms all the way to severe disease. So it's important to really dig in. And when we look at the Johnson & Johnson data, I think there's three numbers to remember. One, it's 100% effective at preventing hospitalizations and death. That's why we are doing all the things we are doing to prevent hospitalizations and deaths. And Johnson & Johnson is excellent at that. It's 85% effective at preventing severe consequences. Some of them do include hospitalizations. The other are low oxygen levels or increased heart rate. 85% effective. And that's 65% effective is against all symptoms, including mild symptoms. So keep in mind that it is 100% effective at doing what we needed to do. And so that's why we're recommending that people take any shot that is available to them. It is going to keep them much safer than if they don't have a shot. In terms of vaccine, we're talking about getting them out, but equity is something that we need to do much more on. Speed has been the name of the game. And while speed is absolutely important, it can't be the only metric by which we judge ourselves. For a really long time, we've talked about what percentage of vaccines have you gotten out in a week or in a few days. We can pump them out. Most places, while there were definitely road bumps along the way, are getting better. It takes a few weeks, they get better. But we really need to focus on equity and make sure that those people who are being hardest hit are also getting equitable access to the vaccine. So we see that from our data, and this is what we just released today. In the county, Blacks are 1.4 times more likely to get COVID. Hispanics are 2.54 times more likely. Blacks are 1.3 times more likely to die. People age 65 and older, all races and ethnicities account for over 85% of deaths, but only 12% of cases. And we're seeing our vaccination rates are lower for Blacks and Hispanics, about 10% and 3%. Compared to populations that are about 17% and 8%. This is a problem. And so we are, after discussions through our COVID-19 Health Equity Initiative, hearing from many residents and organizations, faith community, nonprofits, we're committing to a set of guiding principles and actions to get our vaccinations more equitable. Part of that is repairing trust. But the keys are access, communication, and engagement. Making sure that we're improving access, removing barriers, improving our communication, and then critically engaging with the community to continue iterating and make sure that we're identifying barriers and addressing them. I want to highlight a few items. I'm not going to read the whole thing to you, but one of the keys is that we do have online and phone registration available. One of the biggest pre-registration available. One of the biggest concerns is that not everybody has access to or can navigate websites. We want to emphasize that you can do pre-registration and appointments by phone. That's 410-222-7256. That's our COVID line. We're going to be having community vaccination clinics in partnership with organizations serving communities disproportionately impacted. We're going to be starting with one this Thursday. More information about that coming out shortly. And then we'll be increasing those each week. And our goal is to eventually get to where we're having a community vaccination clinic every day, in partnership with those nonprofits, faith institutions, and other organizations. And the key to that is that they are identifying who in those communities that are hardest hit haven't been able to get vaccinated. We know that our pre-registration system works for some people, but isn't working for everybody. And we can't say that you can only get vaccinated if you can figure out how to navigate this pre-registration system. That's not how COVID works. COVID will infect anybody. And so our job is to get vaccines into everybody who is vulnerable. And so that's going to be a core piece of what we're doing. We've already started deploying mobile vaccine teams for congregate settings, starting with homebound individuals and others unable to easily travel. We continue going to senior housing. We're working with the intellectual and developmental disability service organizations to get vaccinations into those centers and to increase access to our current sites. And so that's going to be a core part of what we're doing. We're going to make sure that we've got better language access, so materials in 3 most commonly spoken languages, obviously English, but Spanish and Korean, bilingual employees. And then in the next few weeks, we're working out a program to be able to fund community organizations to be able to do the education on the ground, healthy education, pre-registration assistance, and other types of engagement to increase vaccination rates. And with that, I think that I am done for now. I'm going to turn it over to Kathy.
Okay, thank you. Milesh, you're always a hard act to follow, but I'll do my best. Thank you. Okay, we're, as many as you know, the county has had an eviction prevention program since last April. And that program was funded mainly through the CARES Act funds. What our county exec just announced and our county council approved last night is that the county has received an additional $17 million through the new federally funded Emergency Rental Assistance Program. And that has been funded through the Consolidated Appropriation Act of 2021, which was signed just at the toward the end of December. This additional funding will allow us to serve many households, and basically the households have to be their income negatively affected by COVID, and households that are at 80% and below the median income. During the first round of the program, we were able to help over 1,000 households with their rent, and we expended approximately $5 million. The second round with the 17 million, we're hoping to serve approximately 3,300 households. We began accepting applications. We, as our county exec announced, we're the first jurisdiction in Maryland to open up our portal. The portal opened up on February 16th. We have been quickly working out the kinks on that process. And in those 2 weeks, we have received over 700 applications already. Renters who want to know if they are eligible for assistance can go to the ACDS website at acdsinc.org. There's a flyer with information on exactly the eligibility and how to apply. And we're also available to answer any questions. One of the big things that we would like to say is patience is a virtue. We have lots of applications. We will get to you if you are applying, if you get into the portal. The other thing you can do is to call us if you're having a hard time completing that application. We have staff on board who will help people and help you get that information together and get the application into us. The moratorium right now is the CDC moratorium on evictions is in place until the end of March. And as you know, the court system is scheduled to open up sometime in the middle of March. We are anxiously all awaiting right now if the new federal assistance bill is passed on the federal level. We believe that moratorium will be extended. So we're anxiously awaiting to see what happens with that. But we encourage all renters who are 80% and below the median income, whose income has been negatively affected by COVID, to get to our website or to call us at 410-222-7600, and you go to extension 2, and we should be able to help you. Thank you.
Great, thanks Kathy, and thanks everybody. We've got some time for questions. So we'll ask as previously, if you can either put your name in the chat or use the Zoom function to raise your hand. We'll call on you from there. And a reminder, we're gonna try and wrap up around 11:30. So first question we'll give to Danielle from the Capitol. You're on.
Hi, good morning. With the Johnson & Johnson distribution to the county, is there an expectation that things will speed up, that more people will be able to get vaccinated, and will anything change about vaccine distribution?
So we'll certainly get those 900 Johnson & Johnson, 400 Moderna. We'll certainly get those 1,300 doses out this week. I think what we don't know is whether those will continue into coming weeks or not. So I just don't know how that's going to affect the pace, or if this is a one-time shot for the next few weeks.
Gotcha. And quite a few folks have reached out to us and asked whether or not they can choose which shot they get. Can they choose?
Well, right now, particularly with the Moderna and the Pfizer, we get what we get and we distribute it, and that's what we're going to be doing with the Johnson & Johnson as well. I get people wanting to choose. We don't really have a great way to do that, and the reality is that honestly, there isn't enough of a difference between them to choose at this time. They're both extremely effective at preventing hospitalization and death and severe symptoms.
Okay, and then really quickly, the health equity plan mentions community sites and community kind of advocates who are going to help more equitable distribution. How are those sites and those people chosen?
So right now we're talking to a wide range of folks, both those who regularly participate in our health equity initiative and those who we're hearing from for the first time. And honestly, it's really just about getting the logistics in place. So it requires a site in the community, folks to be able to, from that organization, to be able to provide some support, identify people to get vaccinated. We'll be doing some of the vaccination. We're working with other partners to do some of the vaccination. So it's really mostly about logistics. How quickly can we bring it all together? And as we go along, we'll just keep doing more and more sites.
Thank you.
All right, any more questions from the media?
Olivia has a question she's going to ask.
Hi, this is Olivia from the Capitol on Danielle's computer. Mr. County Executive, you mentioned you're planning to get the Johnson & Johnson vaccine. Do you have that scheduled, or any firm plans you can share with us at this time?
Sorry about the mute button there. It's not scheduled yet, no, but I expect it to be fairly soon. I've been, as you probably know, in continuity of government, I've been asked numerous times by my staff when I'm going to get this done, and I've waited, and it's time to move forward. And I thought this would be a good opportunity with the new vaccine to hopefully demonstrate that at least I have faith in it as a good option, and hopefully others will as well. So I would expect this week, but I think that's more up to the folks who are doing the vaccinations to decide. I haven't heard about an appointment yet.
Okay, we would love to know when you know. And one more question: do you have any indication on what the governor is going to say today at 1 o'clock?
I do not. We've never been told in advance what the governor is going to say at his press conferences, and I don't expect to be told today, but we'll be listening.
I have to ask anyway. Thank you for your help.
Great. Well, thank you, everybody. A reminder to tune into the library's big announcement at 12:30. The county executive will be in attendance, and we will see you all next week. Thank you.